Susman, Ph.D., is a licensed psychologist and assistant professor of psychology and psychiatry at the University of Kentucky. He is the director of Jesse G. Harris Jr. Psychological Services Center and training director of the University of Kentucky Internship Consortium program. Dr. Sussman's clinical and professional interests include mental health advocacy, program development and administration, clinical supervision, and management of behavioral emergencies.
One of the focuses of yours as a psychologist is mental health advocacy. In your mind, what is mental health advocacy?
Yeah, when I think about mental health advocacy, first I think about sort of advocacy in general, and actually there's a definition of being an advocate that I use a lot, and so I actually kind of jotted it down. But so an advocate is anyone who argues the case for another, one who speaks in support of something, or a person who supports others to make their voices heard, or ideally to speak up for themselves. So I kind of like that. We can be advocates in many different ways by standing up for things that we believe in, but also helping others learn how to stand up and to be able to have their voice. And so I like that. I think advocacy, it can be pretty broad. You can advocate for whatever you believe in, but I think mental health advocacy is where you just are focusing your advocacy efforts on mental health issues. And that oftentimes comes back to things like advocating to improve access to treatment, improving funding for mental health services, and kind of working to reduce stigma surrounding mental health conditions. So those are kind of the big areas of mental health advocacy that I think about a lot.
And I think all of that is very well rounded, and it encompasses a lot of different facets, because mental health advocacy is certainly not just one thing, and it can have many different avenues. What are different ways that somebody can get involved in mental health advocacy?
Yeah, I get asked that question a lot, and it's a really important one. There are a lot of different ways to get involved. Some don't take little or no effort, and then other things you can get really involved. You can spend a lot of effort and time. I kind of think advocacy, there's two steps. One is you want to first be well informed, so you kind of want to learn about the issues so that you're a good advocate in terms of passing on reliable information. And then of course the next part is figuring out how to get involved. But some simple ways to get involved. You can start really with kind of stuff you can do at home. You can post stuff on social media related to mental health, kind of share your favorite links or resources. You might want to write an op-ed or send in a letter or comment, on some post, or send it to some publication or something like that. A lot of people do blog posts, or they'll write short articles. So those are some simple things that you can do. Kind of the next level, I think, is where you start thinking about legislative advocacy, and here's where you would maybe start learning who your legislators are at the state or the federal level, and start kind of getting in touch with them, contacting them. In some cases, we can even, go have meetings with them. You may want to support a campaign of some candidate that you think is really pro mental health, and so you can get involved at that level. A lot of people then want to learn how to sort of share their story or speak up in a public setting, so you can do those kinds of things. Get involved in public education. You can volunteer. You can get connected with a lot of worthy mental health organizations and causes where you volunteer, or you lend your time, or you help them fundraise. And then there's a lot of networking. So you can meet a lot of other people who are advocates, or other people that are involved, and you can make those connections, because I think that also makes you a stronger advocate. So there's tons of ways to get involved. I like to talk about advocacy can be like a little mini habit. So maybe you start out and you say, I'm just going to do 5 minutes a day on advocacy, and maybe you're just like putting something on social media. But if you do something 5 minutes a day and you do it consistently, it does kind of become a habit. And then you can increase and say, okay, maybe now on the weekend I can do 10 minutes, or, and so you can kind of gradually get involved, because we're all busy, and you don't want to sort of overwhelm yourself with your expectations for advocacy. So it's like a lot of things. I think if you start small, you can kind of build from there.
Okay. And now, And I would totally agree. Now, in terms of who is the best candidate, should mental health advocates be people that are suffering themselves from a mental illness? Should it be somebody that's, quote unquote, a typical person that's not necessarily suffering from mental illness, or or a health professional, or is it it can be a combination of all?
I think we need all the voices at the table. So that does include people who've had lived experience with mental health issues, their friends and family. It also includes healthcare providers. It includes our policymakers and legislators. Anybody who's passionate about mental health can be an effective advocate because their voice and their story is important. So I think anybody can get into advocacy.
Okay. Yeah. And so, with all of that, it's very important, when you get into mental health advocacy that you understand the stigma around it. And so with the pandemic and what's going on in the world right now, there's a huge stigma, or I won't say a stigma, but there is a huge case of mental health illnesses just because of the circumstances. And as we all know, there is a stigma associated with mental health. So what is your opinion on this stigma, and where would you like mental health to really, really be in terms of being viewed, come, the next 5 years?
Yeah, the stigma is real, and it's still far too prevalent. I've kind of come to the point where I think I prefer now, instead of using the term stigma, I just really think that what people with mental illness experience is kind of just another form of discrimination. So I really am now just talking more about discrimination, because if you think about it, there's a lot of negative attitudes, there's a lot of negative beliefs, a lot of unfair behaviors related to mental illness and how we treat people. And all of those are really kind of aspects of that element of discrimination. People are viewed negatively. If they have a mental illness, they're sometimes talked about very derisively. They're denied opportunities in society, and they're treated unfairly. And the list kind of goes on and on and on. And, when you consider that we know that as many as 1 in 4 people will experience a significant mental health issue at some time in their lives, this is a really tremendously large group of people. But I also think the stigma or the discrimination can be reduced. We can combat it, and we can do this through education and through raising awareness and through our advocacy. We can inform people about the issues. We can teach them about how to be more tolerant. We can teach them how to talk more sensitively about mental health issues, how to treat people with more dignity, with more respect, and how to recognize that people with mental illness, they're still people first. And so I think all of those are important messages that we can get out that help fight that stigma and the discrimination that goes along with it.
Right. No, for sure. And, just talking about specifically, younger people, when it comes to, being in high school and in college, do you see that mental health, or even graduate school programs, do you see that that mental health and the stigma and just, understanding, mental illness is portrayed and is really spoken about?
Yeah, it's interesting with our teens and young adults, because this generation has been more open and more forthcoming about their mental health issues, and many of them are much more kind of willing and open to come forward and talk and seek help and kind of share what's going on with them, which is great, which is encouraging. But it's also one of the sort of side effects of that is we have like a greater demand now for mental health services, especially on college campuses. Our counseling centers are sometimes overwhelmed with requests for counseling from students. And so I think now we're kind of struggling to keep up with some of the demand. But yeah, I think it's really encouraging. We're seeing kind of a shift in how people are willing to be more open and to talk about what's going on with them.
Yeah. And I think especially during this time, I think, people are, becoming more open, and, I think that's really, really important. So what advice would you give to those who right now are struggling with mental illness, specifically during this pandemic? And what resources, aside from going to see a therapist or find your local support group, would you recommend that they seek out?
Yeah, well, struggling with mental health issues is hard enough just in normal times. And so,
No.
the pandemic, I think it's kind of created a perfect storm for more mental health issues to kind of come out and to get worse, because people are facing these unprecedented challenges. They're socially isolated. They sometimes have lost their jobs right now. So there's financial stress. We've had disruptions at all levels of society. We can't go where we want to go. We can't interact with people as we normally would. And then, of course, the physical health issues, if someone actually has the virus. And then we've now had many people who've lost loved ones to COVID. And so there's grief and there's loss. And so there's, all these things going on, which are not good for our mental health. But I think, there are some things you can do, which are probably helpful. When we think about social distancing, that doesn't have to mean total social isolation. And so we can still connect with our friends and our loved ones through technology, or maybe we can still get together in very small, socially distanced groups, or do things outdoors, those kind of things. I think people really need to still know that they can reach out for professional help if they need it. The vast majority of therapists have shifted to online telehealth services. And so in some ways, treatment may be even more accessible because people can just, get therapy while they're still at home. I think also you got to limit your media exposure. There's a lot of really sad and discouraging news out there right now. And so that can negatively impact our mood, but we have some control over how much we expose ourselves to that. So I think you want to think about that. And then, I think we want to look there are always silver linings, I think. We may actually have more quality time right now with our kids or with our families, because we're kind of stuck inside, and this may be the perfect time to pick up an old hobby, like, maybe you used to play a musical instrument, or you used to do quilting or crocheting or something like that. And then I think, our pets are having the time of their lives right now because we're kind of home with them more. And, so there are some silver linings. As far as resources, we can talk a lot more about all different kinds of resources for, therapy and support, but, there are a lot of, things that you can access just online by going to some reputable websites, mental health websites, and that kind of thing. So there's a lot of ways that people can get some pretty good quick resources.
Mm-hmm. And I think it's important to say that, and I'll be a testament. I mean, I'm dealing with my own mental health stuff right now. But, if you're dealing with, mental illness, to definitely seek help, because, there is support out there, and it's, you're not alone in all of this.
Right.
So many people who have mental illness either deny or kind of hide their mental illness, or don't really or don't really want to talk about it. What are some signs that, or even they may not even know that they have a mental illness? What are some signs that someone should look out for, that should be an indicator that they should receive treatment, or go to therapy?
Yeah, I mean, there aren't any hard and fast rules on when to seek help, because sometimes it can be great just to talk to somebody, even if you're just mildly distressed or something. But, some of the clinical kinds of red flags or markers that we look for is if you've had more than 2 weeks in a row where you've had really, really significant distress, and you've had some probably like impairment in your ability to take care of kind of your basic daily tasks in life. So, for example, if your depression or your anxiety seems really strong, and it's not going away after a few weeks, and it's starting to interfere with your work or your school or your sleep, and you're just really starting to feel miserable, it's probably a good idea to check in with someone to get kind of a professional opinion. And a lot of times the first stop can be your general physician or your nurse practitioner, somebody you already have a relationship with. and they can kind of help you check things out and kind of do a screening, and then they can help refer you to a therapist or other kind of mental health specialist if you need that.
Yeah, no, I mean, those are all great ways to reach out. I mean, there's, and indicators that you should reach out. So now, for somebody who, is ready to seek out professional help, what would be some of the things that a person should look out for in terms of finding a therapist? And, what are some ways that somebody can find a therapist, especially especially for people that live in rural areas? It's not Boston, it's not, a major metropolitan area where there's a psychologist or a doctor's office down the street.
Well, on the surface, you would think this is a simple question that you just find a therapist, but it's really not.
No, I know.
It's really very complicated. And I frequently help people locate therapists and support groups and other kinds of resources. And I think some of the factors that I'm always going to bring up for people to consider, one has always got to be cost. How much is this going to cost you? Can you afford it? A lot of times when people have health insurance, if they can stay in their health insurance network, that's going to be the more affordable option. And so then you have to usually go on the insurance website and figure out, who's in your network and who the therapists are. And then you can kind of go from that list. So that's sort of one thing to keep in mind. The next thing you get into is access, because you may have, 100 therapists on your list, but, some of them, they're full, they're not taking new clients, they're not available. Then you've got to look at location and access. Now at least some of them, a lot of them, you can do teletherapy, so you don't have to leave home. So that's good. But in normal circumstances, you may have to kind of travel a long distance to get to their office, and that may be inconvenient, or the hours may be inconvenient for you. So the access part. And then, you've got to think about their experience, because you want to find out about, do they really have training and experience to help you with your specific concerns? Because kind of like people have different doctors, who are specialists, not every therapist has experience with every type of mental health issue. And so you can't just assume that, everybody's going to be great at, dealing with your depression or anxiety. You really are going to have to kind of make that initial call and then ask them, hey, what's your experience in treating this particular kind of issue? And then they'll be able to tell you that. And then I think just that sort of overall fit with the therapist, because you're going to hopefully talk with them or have an initial consultation or phone call or Zoom meeting or something, but you want to check out their interpersonal style, you want to see what their approach to treatment is, you want to ask about their training. All of these are going to be important to see if you feel like you can fit with them, because you don't want to invest a lot of time and energy into longer term therapy without feeling really comfortable with the person. So I think that's why that initial consultation, initial phone call, initial meeting is really, really critical to see, if that fit is there before you sign on to a formal course of treatment. As far as the urban versus rural thing, again, with telehealth, it's probably a little bit easier, even if you're kind of outside of metro area, because you can connect with people on telehealth. But we're finding more and more that even your smaller cities or towns are still going to have a pretty good selection of therapists. And so, things have improved to some degree in that nature. There's also a lot of support groups out there, and that's kind of a different, kind of situation, because that's really centered around a specific area, alcohol issues or narcotics or, mood issues. And so there, the thing maybe is just finding the kind of support group that targets the sort of issue that you're experiencing. And those are typically, a lot of them are free or very low cost. And then a lot of those are online right now too. So sometimes it may be actually easier to find a support group than it is to find a therapist. So lots of things to consider, and then there's also online directories, like one of the popular ones is Psychology Today has a directory of therapists that you can search for your, in your area. And you can also look at their websites, and you can sort of kind of scope them out ahead of time before you make that call. So I think a lot of it is you want to get information. Sometimes word of mouth is great. You may have friends or family who have been to a therapist and they just love that therapist, and they may recommend someone to you. Your doctor or nurse practitioner may recommend someone for you. You may have a spiritual counselor, pastoral person that can recommend someone for you. So, there's lots of work that's involved in finding a good therapist.
Yeah, no, absolutely. And I think something that should be noted is that, which I think you mentioned a little bit, but is that, it's not 1-2. I mean, you really have to, kind of pull your strings and really kind of delve deep, because there are tons of therapists, and, not everyone is going to be the right fit for you. And it's really important to find a connection with somebody, because not everyone is going to, be the best fit, for that one person.
Yeah, and sometimes that right away, like you kind of can tell it's a good fit, but sometimes you may actually begin therapy, and then a few weeks later you realize the fit is not there, and so you also have to feel comfortable in walking away from it, if it's just not working out, because therapists recognize that there's not always going to be that perfect fit, and so don't worry about hurting their feelings or whatever. If it's just not working out for you, then you need to reconsider and perhaps find a different therapist.
Yeah, no, absolutely. Now, when it comes to therapists, there's lots of different credentials. There's somebody who may be, a mental health counselor. They may be a social worker. They may have their PsyD, which is Doctorate of Psychology, or they may have their Ph.D. or Doctorate of Philosophy. What other credentials, what specifics, should somebody look out for? Because not everyone that has these different levels of credentials, they work differently, and they may not be the best fit for you. I mean, somebody who has who's a mental health counselor may not be the best fit for somebody who has severe depression. So they may, they should go to somebody who has a PhD. So anyways, can you just talk a little bit about the credentials and what that?
Yeah, and you mentioned several of them, but I have a little bit even longer list I can run through quickly. But you'll find people who are MDs, who are medical doctors, and so they may be psychiatrists, and so they're trained physicians, and so they've been through medical school and residency training, and they can prescribe all the medications. So that's going to be a useful thing if you're looking for medications as part of your treatment. Some of them also provide therapy, as well, but you're going to have to find out if that's part of what they do. Also prescribing, you have the nurse practitioners, and now you have psychiatric nurse practitioners. So they have mental health training. They're going to usually have the ARNP or APRN, letters after their name, which is like a, psychiatric nurse practitioner. They can also, of course, prescribe, and then some of them may do some brief therapy, but typically they're not going to be doing a lot of extended therapy. My discipline, psychology, you're going to find the PhDs and the PsyDs, and so those are the licensed psychologists, and we're pretty extensively trained in psychotherapy, and so we have years and years and years typically of training in psychotherapy. And we're also usually the go-tos if people need psychological testing or assessment. So for like testing for ADHD or a learning disability or IQ testing or personality, all that kind of stuff, that's usually kind of in the realm of psychology. So I'm a little biased. Psychologists are, good providers. Psychologists can now actually prescribe medications in a few states, in a handful of states. And so that trend is sort of increasing a little bit. Then you get to social workers. So you have clinical social workers who are going to have like an MSW or LCSW. And so they are also often trained in counseling. So they can provide counseling and therapy. You mentioned the mental health counselors. They will often have like a LPC or LPCC. So that's like a licensed professional counselor credential. And they're trained in providing counseling, of course, as well. The one we didn't mention was LMFTs. So they're the licensed marriage and family therapists. And so they're actually sort of trained to specialize in marriage and family therapy. And then you'll find folks who have training in chemical dependency or in drug and alcohol counseling, those kinds of things. So, again, it's a real alphabet soup, but that's part of why you want to have that, checking out the website, calling them on the phone, asking about their background, their experience, and being pretty explicit, in terms of saying, I'm really depressed. How often have you treated depression? What kind of treatment therapy do you use for depression? And those are the kinds of really pointed questions that you want to ask, because sometimes the credential makes a big difference, and then sometimes it may not make as much of a difference depending on the type of therapy or treatment that you're looking for. But this is all why it is even more when people don't understand all the differences.
Right. Absolutely. So, when does mental health become an emergency and really kind of need to be faced kind of head on?
Yeah, we deal with crisis situations, and sort of the two things that constitute a crisis are some sort of immediate risk of harm to either oneself or to someone else. And so that's why in almost every mental health setting, when someone presents and they're in crisis, the first thing they get asked is, are you feeling suicidal? Do you have some plan to hurt yourself? Do you have some thoughts of hurting other people? Have you acted aggressively or violently? So these are the kind of the standard risk assessment type things that we go for. And then usually based on that assessment, if someone is seen at a really current severe risk for either hurting themselves or others, this may be where a brief stay in a hospital may be needed, just to have them, be carefully observed in a nice, safe environment to make sure that, no harm comes to themselves or someone else. So those are typically the kind of situations you get into that we consider more of like a mental health crisis.
Okay. Yeah. And those are pretty common. And, they're just, they're the classic signs. And I think even if you go to any, doctor, they're going to say the same X, Y, and Z, things, or, criteria. Anyways, if there was any advice that you could give somebody who is struggling from mental illness, what would that be?
I think really people just need to not suffer in silence. They need to, if you're feeling really bad, you need to, come forward and ask for help. There is a lot of help and support available. It may seem like it's sort of, as we talked about, difficult to find that therapist that you feel like you can work with, but you will find that, and that help and support is out there. But you have to first ask for it. You have to, have that courage and strength to ask for it, or to tell someone who cares about you to help you, and then they can help you access the support that you need. I think the other thing people really should keep in mind is that we have a lot of really effective treatments right now. And we have a lot of very science-based kinds of therapies for a lot of mental health issues. There are a number of effective medications. A lot of times the combination of therapy and medication is going to be really helpful for many people. I kind of neglected to mention peer support, because we now have peer support specialists, and these are people who are kind of already through a lot of their recovery journey. They've had mental health issues, and now they've actually been trained to provide peer support to other people who are going through mental health issues, and they do it on kind of that peer-to-peer level. So that's another sort of form of help that's out there. You can find peer support folks working in a lot of mental health settings. And then, once you kind of get plugged in and you begin to get the care and the support and the help that you need, and a little time begins to pass, you can really feel better, and you can have a lot of improvement. And we talk about this idea of recovery as sort of it's a journey. It's not a destination. And people get to sort of their own level of full potential along the way, and it can take a while, but you just kind of have to keep after it. And I don't want anybody to give up hope, because there's a lot of help out there and a lot of support, but it is sometimes the hardest thing is to make that first call for help.
Absolutely. And I think it should also be mentioned that, there's always light at the end of the tunnel. Nothing lasts forever. And I just know from my own illnesses or my own mental health with anxiety and depression, when you're in it, it's hard to kind of see that there will be a light at the end of the tunnel, because, it's frustrating while you're struggling through something. But as I very well know, there's always a light at the end of the tunnel. And so for anyone else, I think that's really important to recognize, even if you're, struggling in the, interim. Just keep going, and, it'll get better, or it'll go away completely.
Right. And you know, I feel like I should also mention, you know, I have a mental health and advocacy blog that I've written for a number of years. And one of the things I feature on there is a lot of what I call them stories of hope. And these are just, you know, people that I interview about their own mental health experience. And we kind of try to paint the picture of the challenges that they face, but also the fact that, you know, they do show improvement in their quality of life over time. And so you see people from really all walks of life and all over the world that are struggling with similar issues. But you also see how, with the right kinds of care and treatment and support, that many people can get back to where they're really fulfilling a lot of their goals and their dreams. And I love to just show those examples and share those stories so that people can see that there really is hope out there.
Yeah, no, absolutely. And I think that's, you know, really important, you know, because it's not easy, and you shouldn't be, you know, alone during something like a mental health crisis. And it's also serious too. So it needs to be taken with the right steps and with caution. So, well, this was wonderful. I think I mean, we gave amazing information, and I think this is going to be really great for our audience.